Hey everyone, I'm Nicole, an occupational therapist, and together with Stephanie, physical therapist, we make up the Note Ninjas. We are a PT and OT duo teaching other therapists, assistants, and students how to document more efficiently and come up with better treatment ideas for better outcomes for our patients. So today, we're going to be focusing on Halloween. So Halloween is coming up. It's so fun, no matter what setting you work in, even if you're in, say, acute care or an assisted living, or working with kids, of course. But if you are working your treatments around a theme, and we really love this time of year because there's so many different holidays that you can work into your treatments to just make it a little bit more exciting and fun for the patients. Now, of course, you need to know your clientele. So not all patients want to really care about Halloween, might think it's childish, but for the patients that are, a little bit more festive and, need that motivation, I think it's a great idea to incorporate the holidays into your treatments. So I'm going to be talking about some different functional activities that we could be doing with our patients that involve Halloween. So the first one we can do is a little like trick-or-treating scavenger hunt. So this is great because it works on so many different skills. You're working on not only ambulation, but functional reaching, visual scanning, fine motor skills, coordination. There's just so many activities. So we have a cute little bag. So what you could do, you can make this as big or small as you want. So for someone who's a little bit more low level or doesn't have that endurance, maybe you just keep it small. You keep it in the gym and you scatter some treats around the gym and have them search for them and then put them in the bag. For an individual who is more advanced and you're working on increasing distance, increasing endurance, you can go and really scatter the treats around a larger area. So you can put them in hallways, you could put them on the floor, you could put them up top. There's so many different variations. You can even tape them to a window or a door and have them really have to peel it off. So they're using problem solving, they're using fine motor skills and dexterity and all those different skills. So there's so many different variations for that type of task. Another activity that we like to do is decorating. So, we don't always have all of the equipment or the tools to do this, but really it doesn't take that much. You can use some like black and orange construction paper and scissors and some markers and maybe some streamers, things like that you can even get from the dollar store, just that you have lying around. And you can create wreaths, you can create window decorations, door decorations, things like that. So that's fun. That gives our patients the ability to use their creativity, problem solve. They're using their fine motor coordination. We can have them pick up tools and materials from one side of the room, transfer them to the other side of the room. So we're working on ambulation. Just another way to incorporate that all in. And the third activity that we like to do around the holidays is some type of meal prep, some type of cooking task. So what we could do is maybe make a pudding, but make it Halloween themed. So you do a graveyard dirt. So the chocolate pudding, you can put Oreos on it, you can put some M&Ms, you can go to the dollar store and grab those themed candies that are ghosts and goblins and all that and stick them in. And that's a great activity to do. That's just a little bit more festive. It's exciting. It keeps our patients motivated. It makes them feel like they have purpose and meaning. And that's really what it's all about. So we hope these tips helped. Happy Halloween if you celebrate. We hope you do some of these treatment ideas and just let us know how it goes. So for more treatment ideas and documentation, make sure to follow us at the Note Ninjas.